Good morning, everyone. Thank you for being with us on this call. Today we have Corey Kalheim with Leading Age, and he's going to talk about the workplace safety updates with OSHA and everything. So I'm just going to turn it over to Corey. Thank you.
Thanks, Paula, and welcome everybody. It's a bonus OSHA day. We were going to talk about the new national emphasis or initiative on the focused inspections, but there's actually two other, for better or worse, other OSHA things to talk about. The second is being the reopening of the comment period for the healthcare ETS that was issued last summer and expired, and we'll talk about that a little bit. And then finally, that just came out at the very end of last month, early this month, was a new proposed rule on reporting illnesses and injuries. And so I will give folks an update on that as well. And so I just have a short PowerPoint here that goes over these three topic areas, and it gives you the links to the regulations itself and or the notice from OSHA. And so the first one is this COVID-focused inspection initiative. So this came out in early March, and this is specifically focused on a 3-month time period until June 9th, so March 9th through June 9th, to go back and have OSHA look at those folks who had inspection issues during COVID, which they will go out and revisit to make sure that they're basically complying with the requirements and making sure they made corrections to what they were either investigated for and or cited for during that the COVID investigation. Okay, now this is only going to apply to certain types. Okay, and I'll get into that, and you'll know if you've had an OSHA inspection and or fine or investigation during this time, but just nonetheless, it's a narrowly focused one. And so we'll make sure we get into that as well. Okay. And so on the first one here, what this is, if you recall, back in June of 2021, so this was last year, OSHA issued that healthcare ETS, and that was the one that came out and said you need to have barriers up. They had some masking rules. They had the rules regarding your ventilation system. They had this whole set of rules to deal with workplace safety. It didn't impact us dramatically in the sense because most of the communities were already doing this under either a CMS protocol or a state protocol. And so we were doing the majority of these, but it was just another burden. And in addition, there were some COVID record keeping requirements. Now, that was an emergency temporary standard. It was only in place for 6 months. So it expired on December 21st. And OSHA acknowledged that those requirements expired on December 21st. However, they kept open the record keeping and reporting requirements, but all those other requirements went by the wayside, including the medical removal benefits and some of the other barriers and all of the other things that went away. When it went away, though, they did mention that they were working on a healthcare standard, so a full-blown healthcare standard. And so what we've seen come of that is two things. We've got this focused initiative that will go back, and then we've got the reopening of the comments period. So with this focused initiative, this 3-month period, it is a limited focus, a reinspection or reinvestigation. Okay, and it specifically applies to 4 types. It applies to hospitals, psychiatric and substance abuse hospitals, and then skilled nursing facilities and assisted living facilities. So those are the 2 communities that are involved with senior living. Okay, so it's a focused partial scope inspection from March 9th through June 9th. Okay, and it's going to select you. You are potentially in this pool if you have a follow-up inspection of any prior inspection of which a COVID-related citation or hazard alert letter was issued. So if you had an inspection or alert letter, you jump in this pool of potential reinspection. A follow-up or monitoring inspection for randomly selected COVID-19 unprogrammed activity to include COVID complaints and or rapid response investigations. And so if you've had this inspection before for some of those issues, and also they're going to look at those folks that had COVID-19 citations that were previously issued as well, whether that was an on-site investigation or a paperwork investigation. So those are the selection criteria. So if you were not involved in an OSHA investigation, you will not be, you should not be involved with this specific program. Now, OSHA may come and respond to a complaint, but that shouldn't be related to this initiative, okay? And they're gonna do only on-site inspections for those communities that currently treat or handle known COVID residents or patients. If they don't treat them currently, they're going to be a records only inspection. However, if you have transfer residents or all of that, they will be subject to an on-site inspection. So I think even though you may not be have any COVID residents in your midst or employees at the time, if you are subject to that and have had those recently, I still think you are of subject, and I think that they would be able to come in and look at you. And so what they're really focusing on is to make sure that any of those citations or actions that you've taken to correct them, to make sure that you've got your COVID-19 plan implemented, which was part of kind of the OSHA ETS and having a COVID plan in place in general. And they're going to refer any vaccination issues or things that they see to CMS, okay? So if they see some vaccination related deficiencies, you're not doing education, you're not following up with getting your employees vaccinated, they are gonna follow up and send those over to CMS. I'm not sure what CMS is necessarily gonna do about those, but they have the ability to do that. And they've made that known in the notice. In addition, they're gonna look at your OSHA, your COVID log, as well as your OSHA 300 and incident reports and all of that. And so that's going to be, I think, key is they're going to come in and they're going to look at those certain areas. I think another area of focus is going to be the respiratory protection program. So make sure you've got the written protocols in place, medical evaluations, fit tests, and all of that. And so that's, I think, one of the other key areas. And they may be able to do a limited walk around of areas designated specifically for COVID-19 residents or COVID-19 patients in the sense of hospitals, okay? And they may potentially do some employee interviews to determine compliance. So that's kind of the general overall of what they're looking at. In addition, they've also said, like in the rule, they're gonna look at your recording and reporting your general duties that you have under there, your respiratory protection, access to medical records, your healthcare record keeping and reporting requirements under the healthcare ETS. And I think one thing that's very, very important though, is they are going to use the compliance with the healthcare ETS that expired as evidence that you are complying with what you need to comply with, okay? And so I think that's important. So even though they that has expired, they're going to say, hey, if you're doing those things, that's what you should be doing. And so we're going to take that into account and make sure that that's going to be kind of in your column of credit when you're dealing with OSHA and this reinspection. And so that's kind of the general overview. I think they're really, I have not heard of a lot of inspections from members at this point. And I think from the anecdotal data, if you were one of those unfortunate folks that had the OSHA investigation, you're throwing into this pool, and then they will select out of that potential pool. And the requirements for this program is that 15% of the OSHA investigations in the region or the area need to be follow-ups from these reports and investigations that were prior. So you're not guaranteed that they're going to come back, but you're thrown into that pool where they have to up their percentage of investigations. So there's going to be a real focus on these four healthcare communities during this 3-month period. I think that the best thing to do is handle this like a typical OSHA investigation. Make sure that when you hear from OSHA, you kind of get your ducks in a row and make sure you've got your point person to deal with your OSHA issues at the ready and involved, and ask them what they're there, what they're looking for, and kind of take it as you would a normal OSHA investigation to make sure what they're looking at, and then shepherd them through that process the best you can. And if you do have an OSHA expert or outside consultant, that's, I think, your first call is to make sure that you've got that in place. So when they do show up, you can handle that like a typical investigation. So that's kind of what we're seeing from this program. You know, as I mentioned, it wasn't widespread. Anecdotally, we heard about less than 10% of members were subject to an OSHA investigation. And so it's not everybody that was subject to an OSHA investigation during this time. But nonetheless, if you're one of those, just be mindful that this program is in place. And there's another, we're halfway through it, basically, but there is a little more time for them to complete these investigations. So if there's any questions in the chat, I'd be happy to answer them now. But we'll have time at the end to come back to this in addition. The next area, so this is the bonus OSHA stuff, and this is going to apply to everybody now. Okay, the next two are wide open and will apply to everybody. And so what OSHA did once they had that OSHA ETS that expired in December, they said that they were really looking for because part of the OSHA ETS was that it was a proposed rule. And so they wanted comments. And so we filed comments, other organizations filed comments. And what they did is that comment period ended last, I think, August. And so they reopened it for another month until April 22nd. So we've got another week or so to put in additional comments. And so we'll add to the comments that we submitted last August. And they basically have asked and said, look, what do we know now in the time frame between the expiration of the OSHA ETS, the new variants, and where we are currently in the state? And what have we learned? What's been effective? What hasn't been effective? What should we do different when we've got a potential healthcare standard moving forward? And what they specifically have asked for, they've asked for comments, and then they're going to have a hearing that starts April 27th. It's going to be an online hearing where folks are going to give testimony. And that actual hearing could go on for days, depending on how many folks want to actually testify. And so they're looking specifically for new data and comments about these following topical areas, okay? Alignment with the CDC recommendations for healthcare infection control procedures, okay? So that was one of the big complaints when this came out last year, was it doesn't necessarily align with all of the other guidance that we're getting from CDC, from CMS, from states and the like, that we were having a real difficult time kind of reconciling all of this differing guidance, okay? They're looking for additional flexibility for employers. And so I think what they're looking at here is, if you're an employer with a good track record of workplace safety, can we have different regulations for those folks versus those who've had a worse history of workplace safety? This is an argument we hear a lot, especially on the nursing home survey and cert side. Why are we surveying every nursing home every year or 18 months when we could be really focusing on the ones that have issues, a better use of resources? And so they're going to look at additional flexibility for employers, and how can you go in and out of whatever requirements are in place, depending on potentially where your community, your broader community, or whether your specific community is with either COVID infections or other infections. And I think and that also goes to the removal of the scope exemptions, when you can go in and out. And this, I think, this general healthcare rule too, I think we have to look at it in the context of, certainly it's COVID-19 focused, but I think they're going to use this as a broader template for the next pandemic, the next viral infectious disease that we see. This could be the template that then springs into place. It's kind of there in the waiting, and then once we hear that, it can be kind of re-upped and triggered as soon as we have the next incident or pandemic that we see. And then they want comments on tailoring controls to address interactions with people with suspected or confirmed COVID. So you have different protocols when you're dealing specifically with COVID individuals versus the rest of the residents. Employer support for employees who wish to be vaccinated, they're continuing that push. We're seeing that they said that they will not require, OSHA will not require vaccination of employees, but we're subject to a lot of other employee vaccinations, especially on the nursing side. And so then the assisted living is kind of in the middle, because they're subject to the healthcare side with OSHA, but they're not subject necessarily to any other mandates, certainly on the federal side, but usually not on the state side as well, as far as vaccinations. They're still going to look at the record keeping and reporting provisions, how onerous those are, what changes may or may not need to be made. triggering requirements based on community transmission levels. What does that mean to trigger the heightened PPE, other prevention protocols that go into place? And then just what has changed and thoughts and ideas of the health effects and risks of COVID since the ETS was issued. So we are, since the healthcare ETS was issued, we are now with second shots, we're now first boosters, and now we're getting close to a lot of folks being second boosters. And what does that mean? And how those strains are different than the original strain of COVID, and how deadly that was, and how we're in a better situation for those that have been vaccinated, boosted, or double boosted at this point. So those comments are due April 22nd, so they're due next week. So just stay tuned for those, and we'll submit additional comments. There's a lot of stuff to think about here. And I think OSHA has a lot of stuff to chew on when they're looking at this proposed rule. The next one. And so this is the final update here. This is a proposed rule that just came out entitled the Improved Tracking of Work Injuries and Illnesses. And what this is updating. It's actually if you've been in this space before, it looks like a proposed rule that came out in 2016 in the Obama administration. It was never enacted because it was delayed for quite some time, and then it was actually rescinded during the Trump administration. So now it is back again during the Biden administration here. And so this is a proposed rule, which the comment period is due May 31st. So we have a little more time to comment on this one, okay? And so, go back. And so we've got until May 31st. And what this is proposing is putting additional information and it's going to apply to most of the employers, because it has some triggering incidents of 100 employees up to 250 or more. And so it's actually lessened it down to 100 or more. Putting additional information in your OSHA 300 and OSHA 300 and A and all those logs. And that would identify and make a lot more information available to the public regarding workplace injuries. All right. And the concern is that you'd be reporting a lot more information, and then attorneys, other groups that may be interested in getting that information can make a freedom of information request, and they can get that information readily available through those requests, and then they would be able to move forward with litigation, other issues that they see fit regarding workplace safety. And so it's a big expansion of what you'd be reporting. And I think that's where the concern is on these logs. And in addition, you're reporting a lot of information already. And so this would really just kind of kick it up the amount of information that you'd have to report as far as detail level, and then subject you to much more scrutiny on workplace related injuries when you're already reporting them, and the nature of that as well. And so there's also the concern that that'd be identifying some potential protected information on the employee side regarding whether it's a HIPAA issue or just employee information confidentiality issues as well. And so that's where we see concerns with this proposed rule on reporting injuries and illnesses. There'll be more information about that. I'm sure we'll submit comments by the deadline as well, but I just wanted folks just to be aware of that. So you have the ability to look at that and take and see if you would like to submit comments. It's very easy to submit comments. If you go to the Federal Register site there, it links through to being able to submit comments, and you can do it just online, or you can copy and paste a letter right in there. It's very, very simple. And it's a quick way to provide feedback to OSHA on this proposed rule. So we'll see how quickly that one moves forward. I think that one is one that we've seen typically before with Department of Labor rules, sometimes yo-yo back and forth between different administrations. It looks like this OSHA reporting may yo-yo back and forth between different administrations as well, if this ever gets enacted. So just stay tuned and be aware of this one as well. And so with that, I'd be happy to answer any questions And there's my contact information if you have additional questions as well. So I don't know, Paula, if you want to unmute folks. I don't know if I have the capability of doing that, but I'd love to hear if there's any questions.
They can do that themselves if they have questions.
Okay.
If we have questions, we have a few more minutes on this time frame.
Yeah, this is Dana. Hi, Corey.
Hi,
I just
Dana.
want to ask, are there any resources that members can use to get ready for a potential survey, OSHA investigation or inspection?
You know, that's a great question, Dana. I would use a couple of different things. One thing you might want to look at is if you've got any assistance from your insurance carriers, because sometimes your insurance carriers and or brokers have some good resources available dealing with OSHA, because it's an area that, although it's been around for a long time, we don't have a lot of interaction with OSHA on a regular basis outside of a specific workplace injury. And usually that focus then has been with that specific workplace injury. So they come in and investigate that injury, whether that's a lift, whether that's some other issue. And so it's an area where we know about, certainly, and we're compliant with our injury logs and all of that, but it's not an area that we, unlike the survey and cert process, that we're subject to every year, and we know how that works. And so I would talk to your insurance carrier or broker to see if they have some good information. I think it's always beneficial just to have a informal plan in place, whoever your OSHA person is, to have a point of contact, to have them be the person that actually greets them at the door, sees what they're up to. You can always, you know, what we tell members is, just because OSHA comes or any other agency comes in your door, it might not be an ideal time to have them all of a sudden start walking the floor and do an inspection, not because there's something nefarious going on, but you just need to be aware of what they're looking at and what their scope is, and then you can proceed accordingly. And so I think it's very important to have a good rapport when somebody comes in, and have that point person in place, and then you can judge kind of what they're looking at on the severity of what they may be dealing with, and then act accordingly, whether that's you know, an outside attorney or consultant that you have. I think that's very important, just to kind of have a process set up in place. And I'm sure there's a ton of resources out on the internet as well, dealing with this, with OSHA investigations, but I don't have one real good resource to recommend at this point.
Thanks, that's very helpful.
Anyone else? We still have a few moments.
And this is not unusual, because it's an area where we don't have a lot of interaction, so there's not as many questions and history. You know, if we're talking about survey and cert or other things, we have questions, complaints, and things we could talk about for days. And with OSHA, it's just a lot of still learning information and kind of digesting it. So it's good that there's not a lot of questions, especially with that focused program, because it's been our experience that we've seen a handful of members that have experienced it, but yet I think the vast majority, unfortunately, were not visited during COVID-19 or COVID-19 related issues.
Well, that's good. So I've put all the information, all the links in the chat, and then we'll have the recording and the chat information in our news and views for tomorrow. So if anybody missed this, or then you can check out everything and then get in touch with Corey if you have questions later. So that'll be fun. All right, Corey, thank you so much. We appreciate your time and effort putting this together for us. And thank you always.
My pleasure.